The candidates laying out their health care agendas in last night's debate. Front and center, repeal Obamacare. Listen.
Some of the people in the audience are insurance people and insurance lobbyists and special interests. I'm not going to point to these gentlemen. Of course, they're part of the problem.
We need to repeal Obamacare completely and replace it with a system that puts Americans in charge of their health care money again.
It's easier to interpret the Dead Sea Scrolls than to understand your hospital bill. The fact is, what we need is transparency with hospitals and with the providers.
I propose a system in which we use health empowerment accounts, which are like a health savings account with no bureaucrats. And we give it to everybody from birth until death.
I will repeal every word of Obamacare.
Thank you.
This as a government official admitting that 8 of the 11 remaining Obamacare co-ops are in such bad financial binds they could collapse by the end of the year. Here with analysis, Kevin McKechnie, Executive Director of the HSA Council at American Bankers Association. He joins me now. Kevin, you heard a lot of the plans last night. The ones that seem to jump out, Ben Carson's, some form of health savings account. What's the right answer?
Well, the right answer is an interesting problem because HSAs and the qualified plans that go with them have been around long before Obamacare was passed. The Affordable Care Act doesn't really infringe on HSAs. In fact, it empowered them. And so it's gratifying to see all the candidates reach out for HSAs as a solution, but it's important to point out that it's been there already, and it'll be there regardless of how the law is changed.
What's the best way to bring down? Remember they said if we just institute Obamacare, the left did, we'll bend the cost curve down. Well, we haven't seen that. How do we really bend the cost curve down?
Well, if you want to find the poster child for health care policy, go to Indiana. In Indiana, they did bend the health care cost curve down. The Affordable Care Act is nothing. It's not affordable. It's not really even attainable anymore. But in Indiana, they found the secret sauce, and that was to convert the plan to HSAs and to convert their Medicaid plan under Governor Pence to HSAs or something like them, the Healthy Indiana plan. As far as I know, it's the only program that can claim credibly that it has bent the cost curve down.
Okay, tell us about this study we just heard, that 8 of the 11 remaining health care co-ops are in financial bind. What happens if they fail?
Well, all of those co-ops and for a large number of states, the exchanges, took into their ranks all of the people that couldn't find insurance previously. And so they've been asked to do something they really couldn't do. There's no health care underwriting anymore. And so obviously they're paying a huge number of expenses and they can't float themselves financially. Those people will be left to the winds. They'll have to find replacement coverage if they can. Can they afford it when they find replacement
what happens?
coverage?
Where do they
That's
go? Where do they go? Do they go on Medicaid? Is that what's going to end up happening?
No, they may not be able to qualify for Medicaid. It depends how much they earn. They could go back to their exchanges. They could buy the policy on the exchange. They could go find it through their bank, if their bank has an individual insurance broker. But it's going to be a challenge for those people. They're going to end up losing coverage.
What about
we would be happy to look at them.
Will the government, the taxpayer, be on the hook for any of the finances of these exchanges that may have put themselves in debt?
You may. One of the challenges with these co-ops and exchanges is they are creatures of the government, and so taxpayer money is at risk here. That taxpayer money, if the exchange is going down, is probably going to go down with it.
All right, guys, say thank you very much.